things. We're going to get into Dr. Saviat, and I'm going to talk a little bit about bunion surgery.
All right. So importantly, when people show up for discussion about their bunion, they usually say, like, I have pain on this bump. And in their mind's eye, they tend to imagine that there's just a big lump of bone over there. And I think Dr. Feldman touched on it briefly there, but it's important to know that that's not just a lump of bone over there. It's that one of those bones is fully deviated from where it ought to be. So on the next image, there's lines that are down the middle of each of those bones. So your first metatarsal is on the left, your second metatarsal is right down the middle. We draw 2 lines, and then we measure the angle in between there. And that allows us to kind of grade out a bunion. So the smaller that number is, so anatomic, no bunion would be around 4 degrees, somewhere in that range. Someone who has a bunion, you're already looking at something over about 8 degrees. And these go up precipitously. Like, the worse the bunion, the bigger the number, generally speaking. And then there are sometimes some other conditions that are underlying that you'll see on one of these slides in a minute that are, it looks like a bunion from the top, but once you see the x-ray, you go, holy crap, there's a whole bunch more here. And in this case, this is sort of like, not necessarily a beginner's bunion, but it was a very mild bunion, somewhere around 10. These are, there's a lot of these roaming around out in the wild. And the way we fix this one is we do it with a bone cut about around the further third on the bone. We cut the bone, we shift it over, and we stick it together with 2 screws. And you can see we reduced that number to somewhere around 6. These were just rough estimates on the angular measures. Now, the other complaint for this woman was she was complaining of the bunion, but also had a very wide forefoot. So the simple procedure for that 5th metatarsal is you can just shave off. You can actually do that to the 5th metatarsal. I do not advocate that for a bunion correction for anyone unless they're basically bedbound and a couple footsteps away from the grave. That would not be a great bunion correction for most folks. So I think I have the lateral projection too. Yeah, so you can see what those 2 screws look like when they come through the bone there. You can actually see the bone cut there on that lateral image. Donna, can you show it was a Kalish on the right side? Can you show that? Yeah, there you go. That's where the bone cut is right there. And those 2 screws fixate that in place. So then the next bunion we have is sort of a bunion that wasn't all that bad by angular measurement, but once we don't have x-ray vision as doctors, but once you get the x-ray, you can really tell a full story about what's going on with this bunion. And in this case, compared to the last bunion, you can see how bad that big toe joint is. So it's been malaligned for so long and not moving in the direction that it should for so long that she totally destroyed that joint space. So in her case, rather than trying to just fix the bunion, we fixed her arthritis at the same time. And the way we did that is we kind of finished the job that nature had started, and we just fused her big toe joint. Now, this woman in particular, I like her a ton. She didn't let that stop her at all. She's great. She runs a big toe joint fusion is a serious procedure. You're off your foot for 5 weeks, but when you're done, you can walk comfortably, you can run. She's running 5Ks and 10Ks and doing very well. She had some other stuff going on with an injury to her second toe. That first surgery I showed you there, the previous patient, that's a surgery that you can weight bear on immediately in a walking boot under most circumstances, as long as you behave. In this case, this bunion correction to fix the arthritis as well, you're off of this for about 5 weeks. Now, the worse your bunion gets, the more significant the recovery tends to be. This is that same person again with the big toe joint fusion. So now we're going to an even bigger bunion. And you're starting to see those angles are increasing. So now we're up around almost 19 degrees. That's a pretty significant bunion. This actually tends to be right in the wheelhouse of the types of bunions that I get all the time, because everybody else in the community doesn't want to touch them and they send them to us. And if you can also look at her x-ray on the right-hand side, on her 3rd metatarsal, she had a stress fracture. When these bones are unstable in the sort of left to right direction, as Dr. Feldman was showing you, they're also unstable in an up and down direction. So as a result of that, you tend to see overloading of the bones next to it. So she managed to skip her 2nd metatarsal, but she fractured her 3rd metatarsal there.
Hey, Ben, Don, just go back 1 slide. Go backward. And then, Ben, just comment on the lower slide. Look at that second toe floating, because people should understand that when you have bunions and arthritis, they're
Yeah.
often not in isolation, and it really creates a lot of instability to the rest of the foot. But this is a great example of what happens.
Yeah, so she totally blew out the ligament that holds her second toe down. If you go back to the AP done, yeah, so that construct up there, there's a button-based anchor and an absorbable anchor in the second metatarsal that basically it makes an anatomic version of that ligament to hold the toe down. So it's a nice stable toe for her now long term. But that developed because of her bunion and her overloading that second metatarsal joint, that second toe joint, basically. So this is a super common bunion that I end up correcting all the time, somewhere in the like 15 to 25 range. And you can see how rather than going and cutting the bone up halfway along the shaft, you wouldn't get a very good correction, and you're not going to correct the instability. So you have to go correct that at the base. The analogy I use in the office a lot is if a contractor came into your house and you had a tilted wall, and they said, oh, I'm going to cut that wall at waist height. I'm going to push it over, and I'm going to put some rebar behind there to hold it together. Well, that's fine if you don't intend to live in that house for very long. But if you're going to be in that house for the rest of your life, you want the contractor that's going to come and fix that tilted wall at the foundation and put it back and keep it stable so that you can live there for the rest of your life. So that's what this surgery is. We go and we sort of sacrifice a joint and stiffen that joint right there and put a screw and a staple across it. It's really minimal fixation, which is great. But this is something that you're off your foot for 6 to 8 weeks before I let you before you walk on it. All right, and then the next one. This is a foot that I just like to show you how bad some people let their feet get before they come in to be seen. Super nice woman. She's a nurse. She just never had time to get her foot fixed. On the image on the right, the yellow angle sort of shows you how that angle can lie to you. So it says it's a 14, but her first metatarsal is so far off to the right that it's off from the long axis of her foot. So the real measure of that angle is probably somewhere around 33 to 40. So that's a crazy big bunion. That looks like her big toe joint is trying to hitch a ride, like she's hitchhiking all the time. And she had other deformities as a result of that. She has a ton of arthritis in the middle of her foot because that first metatarsal is so unstable. She just kept loading through joints that weren't supposed to be loaded until she developed arthritis through the middle of her foot. So she ended up with one of my favorite constructs, which is screws and staples through all 3 of those joints in the middle of her foot. And you can see that all of those bones line up a lot more straight now. And she has a foot that can actually fit in shoes. And we corrected the position of her big toe joint so it sits on straight. We corrected her hammer toes. This was a big surgery. This took me, I think, 3.5 or 4 hours to do. But she has a totally different new foot. And that sort of shows you the spectrum of itty bitty bunions all the way up to pretty big bunions. And the level at which you have to do the correction kind of varies on the bunion, and what you do to correct that bunion kind of depends on the bunion itself. You guys have any other comments on surgery stuff there before I... big bunion, this woman was off her foot for 8 weeks.
Very good, Dr. Saviat. Thank you. Thank you for sharing those. We go back and forth in the office and look at these. So very good.